Mr. Speaker, speaking as a pediatrician, I want to emphasize the importance of attachment to the early development of children, the importance of breastfeeding in facilitating attachment and in the lifelong health of a child, including, for example, decreasing the likelihood of diabetes, is well known. The 2012 report of Healthy Child Manitoba said that the rates of breastfeeding are lower in northern Manitoba and in lower income areas of Winnipeg. I asked the Premier today what action is being taken to address the low rates of breastfeeding in northern Manitoba and in low income areas of Winnipeg.
Here, we were the first province to introduce the prenatal benefit here in Manitoba. And, not only was it a dollar benefit, but there was also the support of a home visitor, a person to work with the family, the young mother, and members of her family to get off to a healthy start. This is part of our early childhood development strategy in Manitoba. We continue to make sure that program is well financed and moves forward. We want these people to have all the supports they can to get off to a healthy start in their lives. Nurses are available as well in the community, Mr. Speaker. There are places where young parents can come together at schools and in family resource centers where they can get support from their peers and other members of the community. All of these things are intended to foster the greatest possible ability of a young mother to support her child, Mr. Speaker.
Mr. Speaker, the Premier says one thing and his government does the other. The very areas of Manitoba with lower rates of breastfeeding are those with high rates of CFS child apprehension. I now table a document that shows that for many years, today's NDP government has supported policies resulting in almost one baby being apprehended at birth each day in Manitoba. Wow. That's 2% of all infants in the province being torn from their mother before they have a chance to bond. And in some areas, it's much higher. I asked the Premier, why is his government being apprehending so many babies instead of supporting mothers to care for and to nurture their children?
Mr. Speaker, I appreciate the information brought forward by the member opposite, and I would say to him this: we are making substantial investments in young families. The rent assist itself will put more money in the hands of young families. The job supports for young families, particularly lone parents, to get opportunities to enter the labor market and get training, are intended to help lone parent families get off to a healthy start and have the ability to have a career for themselves. I mentioned the prenatal benefit and the early childhood development program and the family resource centers and our daycare program, including infant daycare, Mr. Speaker. Every place we're building new daycares, if there's a need demonstrated in that community, we are putting infant spots in place in those daycare centers. So there's support for the youngest of families and their infants, particularly if the parents feel the need to be attached to the labor market, Mr. Speaker. So all of these things are intended to be community-based interventions to support families and to support communities to support families. It's all about a child is raised in a village, Mr. Speaker. It's the parents, it's the extended family, it's the other members of the community, and the professional supports we put in to walk that journey with them to healthy life as young families, Mr. Speaker.
Mr. Speaker, our province has an extraordinary high rate of apprehensions of children at birth compared to other jurisdictions. This is preventing mothers from nurturing their babies. Instead of going in every direction, the Premier should know that there are two local projects, one at Mount Carmel Clinic and the other at the Nishishawashi Cree Nation in Nelson House, that have found ways to support families that dramatically reduce the number of children being apprehended at birth. And so I asked the Premier, why is he not ensuring that these examples, these best practices are occurring province-wide in order to reduce the apprehensions of infants at birth and allow more mothers to nurture their babies? Why, for 15 years, has things been going in the wrong direction?
So I appreciate the member acknowledging that we've supported these demonstration projects in high-need communities, such as Mount Carmel Clinic, such as Nelson House, Nisishiwaysak First Nation. Those are communities that have taken a forward-looking approach to caring for young families. And Mount Carmel Clinic itself has always been a leader in this regard in the inner city from the earliest days. And we were there. I believe I was there with Minister Chief just over a year ago when we saw some of the work they were doing in their early childhood learning center. They're expanding that program. For the Minister of Jobs and the Economy. Thank you, Mr. Speaker. I was there with the MLA for Point Douglas, and we looked at some of the work being there. There's also, in another part of Point Douglas, another very important project called Project Bold, an early childhood development project supported by the McConnell Foundation. So everywhere in Manitoba, we're partnering up with communities to do prevention. We're partnering up to have family support workers. We're partnering up to support families with parenting skills. We're partnering up to provide healthy food alternatives to those young families. The prenatal benefit I've already mentioned. We have nurses available. We have family support workers available. More work needs to be done for sure, Mr. Speaker, and we will continue to do it. And I only ask for the member of River Heights for once to support these things in a budget by voting for it, Mr. Speaker.